The Department of Clinical Health Psychology's residency program in the Max Rady College of Medicine, University of Manitoba, has a long and proud history, welcoming its first 2 trainees in 1969, becoming the first psychology residency program in Canada to be accredited, and leading innovations in training over the decades. The success of the residency program has related to the success and growth of the department and dedication of the clinical faculty. Wherever the department has evolved in health services, it has created opportunities for resident training as well. The breadth and range of training rotations and a department culture that clearly values our learners have attracted top trainees from across the country to our program year over year. And Manitoba has really benefited through the retention of these clinical psychologists to provide care in the province.
In the late 1960s, Dr. Robert Martin was recruited from the University of Colorado Medical School to Winnipeg to become chief psychologist of the complex of Winnipeg hospitals, which were soon to merge into the Health Sciences Centre, Manitoba's largest teaching and tertiary care hospital. His mandate also included establishing a clinical psychology residency program at the University of Manitoba's Medical School. Dr. Bob Devon Flint was the very first residency training director, followed by Dr. Eric Ellis, a psychologist who headed psychiatry's HSC Adolescent Day program. In 1978, the residency training expanded from HSC to St. Boniface General Hospital. Accreditation was initially established in the 1970s through the American Psychological Association, and subsequently the program obtained dual accreditation in 1988 with the Canadian Psychological Association once CPA began accrediting residencies.
In 1989, Dr. Bob McElraith was appointed Residency Training Director, and during his 10-year term, there was an expansion of training seats through the establishment of the Rural and Northern Training Program. This novel program challenged the status quo of fly-in itinerant service, instead supporting psychologists to live and work in the communities and supporting residents to have an immersive training experience through a full in-community rotation. Dr. John Arnett was appointed as section head for psychology in 1990, taking over from Dr. Martin, and together John and Bob worked with the Deputy Minister of Health, Dr. John Wade, a former Dean of Medicine, to fund this combined community-based service and training program. Doctors Lisa Keith and Karen Dick were recruited in 1996 as the very first psychologists in the Rural and Northern program, one based in Thompson and one in the Interlake. As of 2024, this program has trained 66 residents. During this same period, there were significant developments for psychology in the Faculty of Medicine, transitioning from the section of behavioral sciences to a full department. This was propelled by the rapidly emerging field of medical psychology and the growing evidence that psychology played a vital role, not only in mental health, but also across all areas of health and medicine. Through Dr. Arnett's leadership and with resounding support from clinical department heads and the Dean of Medicine, Dr. Nick Antonison, the Department of Clinical Health Psychology was established in 1995, with Dr. Arnett serving as the inaugural department head from 1995 to 2005.
In 2000, Dr. Brian Postal, CEO of the Winnipeg Regional Health Authority, established clinical health psychology as a full regional program with responsibility for psychological services across hospitals and healthcare facilities. This change not only unified psychologists professionally in these various sites and services, but also paved the way for residency training expansion in Winnipeg beyond the Health Sciences Centre and St. Boniface Hospital. Clinical health psychology as a new regional program extended into clinical areas such as cardiac sciences, pediatric diabetes, women's health, chronic pain, bariatric surgery, and primary care, all of which opened up new opportunities for resident training. Dr. McElraith was appointed head of the department and medical director of the regional program in 2005 and served in these joint roles to 2015. facilitating growth in specialist areas across the Winnipeg sites. In that same period, Dr. Valerie Holmes became the first woman to serve as training director, and she further championed the distributed education training model during her decade in the role. She was followed by Dr. Mike Teschuk, who was training director to 2019. Mike, along with Dr. Leslie Graff, who was appointed in 2016 as Clinical Health Psychology's department head and program medical director, successfully advocated for additional training seats to meet the ongoing need for psychologists in the healthcare system. Dr. Graff became the first provincial lead for clinical health psychology in 2019 and has worked closely with the provincial government and health leadership to increase psychologist positions in the healthcare system and residency training seats, with the expansion of the health system psychologist workforce by almost 40% and a doubling of the residency program training seats.
From a single training site and the first two trainees, Florence Van Tress and Christine Williams, our residency program now offers rotations at over 30 training sites throughout Winnipeg and the province, and has an annual residency cohort of 13, with an additional 4 training seats funded and poised for phased growth. We have approximately 70 core clinical faculty in the department under the College of Medicine, all of whom hold medical staff appointments at the various hospitals and health centers, and many of whom are nationally and internationally known clinician scientists in diverse areas such as insomnia, anxiety disorders, inflammatory bowel disease, chronic pain, and perioperative mental health. The residency training streams span child psychology, adult, medical psychology, neuropsychology, and lifespan rural practice. Our most recent accreditation review in 2024, under the current training director, Dr. Trish Fuhrer, earned high praise from the reviewers, who described the program as truly outstanding and could be considered a model program for psychology residency training in Canada. To date, we have trained close to 400 clinical health psychology residents. I am honored to be part of this department, which has established an amazing legacy, including a profound impact on professional psychology across Canada. CHP is well positioned to train future generations of clinical psychologists. Congratulations on 55 years of training excellence.